Mr. Chairman and distinguished subcommittee members, good morning. My name is Mark Smith, and I'm president of Merritt Hawkins Associates, the largest physician search and consulting firm in the nation, and a member of the AMN Healthcare. In the course of my 24 years of Merritt Hawkins, I've consulted with thousands of physician practices, and my company has produced numerous white papers, surveys, and books concerning physician practice patterns and related topics. I appreciate the opportunity today to address a subcommittee on the decline of solo and small physician practices. For those who remember the Marcus Welby MD TV show, may still have an image in the mind of a physician as a small business owner running their own practice. This classic model of independent physician practice still exists today, but is rapidly becoming a relic of a bygone era. Today, physicians are more likely to be employees than they are to be medical practice owners. This is particularly true of medical residents completing their training. In the 2011 survey, as mentioned by Merritt Hawkins, only 1% chose to be a solo private practice physician. By contrast, 60% said they would prefer to be either a hospital employee or work for another entity. In short, virtually no one wants to be Marcus Welby anymore. This represents a fundamental transformation in the structure of physician practices away from the classic private practice model and towards employment and an increasing number of other practice options. There are 5 primary reasons for this transformation taking place, and they include flat or declining reimbursement, growing regulatory and administrative burden, malpractice cost, information technology implementation, and the effects of health reform, both legislative and evolutionary. First, reimbursement. In the days of Marcus Welby, both Medicare and private insurers typically paid physicians for usual and customary charges. Physicians generally were paid for services invoiced at an amount above their cost of doing business. The system has been repeatedly modified in an effort to reduce costs and to manage care. Physician reimbursement in some cases has been cut or has not kept pace with inflation. As a result, today, physicians see little connection between their costs and the amount to which they're reimbursed. This is a difficult business model to sustain. Some small private practices are having trouble keeping their doors open. There have even been reports in recent months of a growing number of practices going out of business, something I have not seen in my 24 years with this organization. By contrast, employment provides physicians a safe harbor from today's challenges and from the uncertainties that lie ahead. Regulatory burdens, virtually all businesses are subject to regulatory compliance of some kind, and medical practices are no different. As a small business owner, physicians must abide by equal opportunity and worker safety laws, state and local ordinances, and many other rules and regulations. Adding a layer of complexity, physicians work in the most highly of all regulated professions, having to comply with HIPAA, Stark laws, Medicare, and many other regulations. It's concerning to me that a survey conducted by Merritt Hawkins stated that physicians spend 26% of their time doing paperwork. Many physicians see employment as a way to escape the rising tide of risk and regulation and allow them to focus on patient care. Malpractice. Among the various costs of doing business, small business owners must pay for their own malpractice insurance, the cost of which could be debilitating. For example, the annual premium for malpractice in some parts of Florida for an obstetrician can exceed $160,000 a year. As malpractice rates remain high, employment becomes an attractive option to physicians, as employers typically pay for this benefit. For a variety of reasons, physicians are obliged to incorporate a growing level of information technology into their practice, particularly EMR or electronic medical records. While the federal government has provided reimbursement funds for physicians to implement EMR, many still find it difficult due to a lack of time and available expertise. EMR implementation is a key example of how the resources, expertise, and time of a small medical practice owner are being taxed in today's increasingly complex medical environment. A growing number of physicians are embracing employment again as a potential refuge from these challenging concerns. Health reform is a driver of a number of healthcare trends, including the decline of small private practices. Health reform encourages the consolidation of physicians into larger entities to gain economies of scale. In addition, health reform promotes the formation of new delivery models, such as accountable care organizations, or ACO, which depend upon hospital and physician alignment in the use of advanced information technology. ACOs are also risk-bearing entities and as such require a high level of administrative and business expertise. It is difficult for a solo or small practice physician to participate in these models, which naturally lend themselves to larger organizations. Combined, these factors and others have created conditions in which small private practice is increasingly untenable. This model is more likely to survive on either small rural areas where there are few physicians, and even in these settings, physicians will need to affiliate with larger entities. Otherwise, physicians are likely to be employed by multi-physician groups or by hospitals, and the era of Marcus Welby will rapidly disappear into our rearview mirror. Thank you for the opportunity to address the subcommittee and for examining the challenges facing America's solo and small practice physician.